The person, the guest that we are so honored to have this morning is an absolutely perfect role model for us in the situation in which we find ourselves. He's a man that is a pioneer in stepping up against being in a system, seeing that the system isn't working, and saying this isn't right, and doing something about it. You can read his full bio in your programs. I'll keep it short and sweet. We are incredibly honored to welcome to you this morning, Mr. Stephen Lewis.
I'm here this morning out of an intense personal loyalty to both Alicia and Lee and the remarkable work they've done. I spent almost 6 years as the United Nations envoy on HIV and AIDS in Africa, tramping through the high prevalence countries. And it is, as you can imagine, profoundly emotionally devastating to encounter the catalog of death which enveloped those countries day after day in the most ghastly of human circumstance. We are inevitably, as the years go by, making some progress. We have more people in treatment. There is intense focus on prevention. There is a great deal more caring. There is an almost superhuman struggle to discover a vaccine, thus far unsuccessful. An equivalent struggle to discover a microbicide, thus far unsuccessful. The only unexpectedly effective preventive technology that has been discovered in the last couple of years is male circumcision. As a result of studies in Uganda and Kenya and South Africa, it has been learned that the transmission from an HIV-positive woman to a man who is circumcised reduces the level of transmission for the man by up to 60%. That's quite startling, and therefore from Rwanda to Swaziland, there are significant efforts being made by the governments to provide surgically safe and secure circumcision. But unfortunately, that does not transfer to the woman. And inevitably, the most disproportionate vulnerability of the pandemic lies amongst women and girls, and that is entirely because of gender inequality. The pandemic is driven primarily by predatory male sexual behavior. And so you have, as all of you know, this astonishing reality on the continent of Africa, where of the roughly 23 million people living with the virus, 61% are women and girls, and in the 15 to 24-year-old age group, which presumably encompasses most of the people in this room, and the several million people living with the virus, some 75 to 80% are young women and girls. It's a nightmare. It's like a Darwinian selection of one sex for the most ferocious assault. But beyond the women, there lie the children. And because Keep a Child Alive has child in its title, I thought I would focus my remarks almost exclusively on the children, and then maybe in an exchange thereafter you could broaden the compass of discussion. Most of you will know that the vast, vast, vast majority of children who are infected derive the infection during the birthing process. There are now roughly 400,000 to 500,000 children a year who are born HIV positive. There are over 2 million children who are now living with the virus. If they don't get treatment almost immediately, 50% of them die by the age of 2. 80% of them die by the age of 5. These are agonizing and ghastly deaths. I don't want anyone to think otherwise. It is a terrible evisceration of the human condition. One of the most painful realities is that none of it need be. I mean, what Kate was saying was entirely true. The remarkable passivity and criminal negligence of the international community in responding to HIV and AIDS in Africa in particular seems to know no limits. And so even though we have the drugs to prevent the transmission from mother to child, we do not make them available. only 1/3 of all the HIV-positive pregnant women in Africa have access to the drugs. There is one wonder drug called nevirapine. You'll be familiar with it. You give one tablet to the mother at the point of giving birth. You give the liquid equivalent to the infant within 72 hours of being born, and you can cut transmission by around 50%. And if you combine it with AZT, you can reduce it by 60 or 70%. But only 1/3 of the HIV-positive pregnant women, as I said, in Africa even have access to the drug. And let it be said, because it's important, that in the United States, your country, Canada, my country, Western Europe, you'd never have a transmission rate of 50, 40, 30, 20%. We put the HIV-positive pregnant woman on full antiretroviral therapy for the bulk of her pregnancy. And as a consequence, the transmission declines by up to 99%. I dare say there are very few people in this room, if any, who know of the birth of an HIV-positive child in North America. It virtually never happens. But it happens all the time in Africa because we refuse to help to repair the infrastructure, the health systems, the requirement for additional human resources, and the drugs to keep children alive. And it's an astonishing commentary. You have to ask yourself, why is the life of a Western child worth so much more than the life of an African child? I've always believed, for what it's worth, that lying at the root of the response to HIV is subterranean racism, and I'm not going to play any games with that. My mind goes back to Rwanda in 1994, when between April the 6th and early July, 800,000 people were slaughtered in the full light of the world, and the world raised not a finger. And everybody said never again. And along came Darfur. And now everybody says never again. And along comes the Congo. And everybody says never again. And we have this astonishing conjunction of poverty and AIDS on a continent, and we refuse to respond adequately. In one sense, it's denial on the part of the Western world. In another sense, it's indifference to what happens in the most impoverished countries of the world. But don't kid yourself. There's just no explanation that doesn't include some element of subterranean racism, because there's no other way to explain the behavior in which the world is engaged. When I was in Zanzibar, the island that is part of Tanzania, and I was visiting the local hospital, and they had 123 people on the list who required treatment. They were so sick they could barely get themselves down the corridor. They were being brought to the hospital in wheelbarrows by their friends. And I spoke to the hospital superintendent, and I said, what the hell is going on? Why aren't these people in treatment? And he said, Mr. Lewis, we can't put them in treatment. We require a CD4 count before we put them in treatment. We have to measure the level of infection in the white blood cells. And I said, no, you don't. The World Health Organization says that if people present themselves in a way that allows you to know that they're seriously in the thrall of AIDS, you can treat. If they're in stage 3 or stage 4, simply by looking at them, you can treat them. And the third area of children, which I just want to touch on because I don't know quite how to deal with the realm of children without at least making reference, is the monumental number of orphans who are being left behind. And this is not adjacent or peripheral to the work that Keep a Child Alive is doing, because I know in a number of places, as you saw in some of the Alicia Keys video last night, Keep a Child Alive is working with the grandmothers who are looking after the orphans. It's as though nobody anticipated the orphans. It's really quite extraordinary. You would have thought that all of us, particularly UNAIDS and the World Health Organization and UNICEF, that we would have intuited that when you have such a vast swath of death, such carnage in that generation between the age of 15 and 49, you're going to have huge numbers of orphans left behind. No one was prepared. So you've got 15 million children, many countries with more than 1 million orphans, far too poor for the communities to absorb them. The extended family is decimated and cannot take them on. And the unsung heroes of the continent, as you saw in the video last night, then become the grandmothers. The grandmothers bury their own adult children, and at the age of 60, 70, and 80, they begin to parent again. And it's an astonishing act of courage and resilience. There has never been such a construct in human history, not even the Black Death of the 14th century. Millions of orphans being looked after by millions of grandmothers. It's as though we were redefining the human family. So on the one hand, you have Keep a Child Alive deeply engaged in this process of preventing transmission. On the other hand, you have Keep a Child Alive deeply engaged in providing drugs for kids who are themselves infected. And in addition to that, inevitably, you have Keep a Child Alive engaged with the grandmothers and the orphans, because more and more Lee and Alicia encompass the whole realm of vulnerability. And it's deeply important. It's fantastic that you are engaged in this. And I want to echo what Kate said, because it's terribly important when she described you as activists. It's significant to raise the money. That's at the center of what you're doing. And it's significant to raise consciousness, because that is fundamental to embracing a society and getting people alerted and aware. But it's also important to apply pressure where you can. And you've got a new administration in the United States, and you'll have a much greater susceptibility to doing good and progressive things. And therefore, it is useful on campuses to raise the alarm bells about what is not being done, as well as raising the money to get it done. And I appeal to you, therefore, to allow the dimension of activism to suffuse your souls as much as your compassion embraces contributions. You know, in the middle of this wild financial convulsion that engulfs the world, Bono held a press conference in New York. He was flanked by Gordon Brown, the Prime Minister of the United Kingdom. And Bono, with his usual acid exasperation, said that he didn't understand how the United States, in 48 hours, could raise $700 billion to bail out Wall Street, but they couldn't find the $25 billion they had promised at the G8 summit in July of 2005 to provide for Africa the Millennium Development Goals. And it was a fascinating juxtaposition. $700 billion in the snap of a finger. $25 billion from the entire G8 countries that will never materialize. And a big chunk of that money was intended to defeat the pandemic of AIDS. And it says something about the moral anchor of this world. It says something about the nature of human priorities. So I really salute you. I believe, as Kate does, that if there is a throbbing movement on campus with all of the extraordinary materials which KCA provides, Lee, I couldn't get over, Lee Blake is in the audience now, I'm just paying homage as is necessary. But I do want to emphasize that you're right at the heart of this struggle. And your work becomes ever more important given the financial crisis internationally, which will undoubtedly scale back some of the contributions that are made. I watched that bizarre vice presidential debate of yours. Well, I travel around Canada and the United States all the time. As a matter of fact, I was in Phoenix the night of the election in McBain country, or McCain country, or whatever you call them. I don't pay much attention. And even even though it was McCain's hometown, they were high-fiving in the hotel lobbies and the cafeterias and getting tremendous pleasure out of the Obama victory. And I was just in Johannesburg 2 days ago at a conference, and Bishop Tutu was speaking. And Bishop Tutu fashioned his entire speech around what had happened in the United States. He even uttered the memorable finale phrase, "Yes, we can." And it was fascinating to see the way everything is now being fashioned in the context of what's happened in the United States. But if you remember that vice presidential debate, in the middle of the debate, the moderator asked the two candidates, where are you going to cut back given the financial crisis? And it was Joe Biden who answered. And he said, it's very difficult to predict in advance, but I think we would probably start with, quote, foreign assistance, close quote. I'm quoting him exactly. And that may or may not happen, but it is true that when a society is under financial siege, you tend to cut back on the non-domestic requirements in order to satisfy your local constituency. And if that happens, it means that the money you raise for Keep a Child Alive and the work you do for Keep a Child Alive is that much more important.